chronic obstructive pulmonary disease is a debilitating disease, and this is a disease of the respiratory system that is usually as a result of exposure to what we call noxious substances. So for example, smoke, dust, industrial chemicals, so usually particles that are in the vaporized form that you breathe into your lungs. So for example, you cook with kerosene. Kerosene will usually produce some fumes, and those ones, when you inhale them, may be injurious to your lungs. Same for charcoal, and same for firewood. The smoke, if you inhale it, can cause problems. If you're also a carpenter and the sawdust, you also inhale it, it can lead to damage of your lungs, and this is usually because of what we call inflammation. You inhale it in the lungs, the body will try and fight, to try and remove, but if you continue to expose your lungs to such substances or particles, then in the long run, they end up damaging the lung. Most commonly, cause of this is actually cigarette smoking too. Okay, because when you smoke, you inhale in. When you smoke a cigarette, you inhale the smoke. When you continue to inhale the smoke over a long period of time, it will injure your lungs and cause you to have COPD. So COPD, the hallmark of the disease is usually shortness of breath. Okay, and then there's a test that we tend to do for these patients to just try and demonstrate what we call airflow limitation. So COPD may not be, is not a curable, it cannot be cured. It's a disease that we treat and manage to try and improve the quality of life of the patient once it has already happened. But this is a disease that can be prevented, okay, by making sure that we minimize or reduce exposure to what we call biomass or indoor pollution from charcoal, firewood, kerosene, and outdoor pollution from motor vehicles and industrial fumes, to actually have a clean environment to try and mitigate for this disease. So it can be prevented and it can be treated, but it is not curable.